I'm Sharon Courtney, and we're talking to Dr. David Mushatt, who's on the front lines of treating patients for COVID-19. Are there times we need to be specifically vigilant about whether we might have gotten coronavirus?
Well, yes, Sharon, of course. So if you have been exposed to somebody with proven COVID-19, then of course it behooves you to contact your provider and discuss with them whether or not testing is appropriate. Other situations where it might be important would be if you've been to an area that has a high prevalence of the infection, i.e. where you're hearing that there are a lot of cases, then you need to be more vigilant. And certainly if you're 65 and older, if you have chronic diseases like diabetes, liver disease, immune-compromised conditions, then you also want to be more vigilant.
If I think I've been exposed, what are the common symptoms of COVID-19?
Okay, so if you think you've been exposed, you're going to be looking for symptoms such as fever, which is seen in 85 to 90% of people, but also maybe a dry cough and even some shortness of breath. And then occasionally some people will have symptoms such as muscle aches and pains and fatigue, diarrhea, vomiting, sneezing, all these other kind of symptoms. So unfortunately, it does look a lot like the cold, the flu, or allergies, and that's what gets tricky.
If I have a cough, what should I do?
So if you only have a cough, you're probably a little less likely to have it, but some people have the cough and don't have the fever, and some people have the fever and don't have the cough. So if you have either cough, fever, or shortness of breath, you do have to think about the possibility. Again, the best thing is to contact your provider. I'm getting emails from patients and portal emails on the electronic medical record for these kinds of questions. It's a great way to handle these questions and to educate our community and our patients as to how to proceed.
What should I do if someone around me coughs? Do they need to go home?
Well, somebody around you coughs. First of all, you need to educate them to cough away from you, to cough into their sleeve or into a tissue. So we need to teach each other how to be better infection control people. Number two, if they're coughing and it's new and has been going on for months, then yes, they probably need to go home and contact their provider to see if anything further needs to be done. So educate, tell people to go home. And again, social distancing is the key thing here. Make sure that if somebody is coughing that you're keeping 6 feet away. That will likely protect you.
Tell us what steps Tulane is taking to protect patients and help identify those who may be positive.
Right, so by Tulane, I think we probably mean, for example, Tulane Hospital or Tulane Medical Center. So very early on, we implemented screening of everybody coming in through a restricted access. So some of the entrances have been closed, and there's restrictions on where you can access the inside of the hospital. There are screeners there that are asking you, have you had a fever? Do you have a cough? If people do, they're turned away. So they started this very early on, and I think this is going to make a big difference. But in addition, access is more restricted. The other thing to keep in mind is that we are limiting visitors. We have a visitors policy which limits visitation to as few people as possible and to essential visitors.
What steps is Tulane taking to protect its own healthcare workers?
So from early on, we started educating our healthcare workers about the illness, about social distancing, about the importance of hand washing, not touching our faces, taking good care of ourselves, and most importantly, we've educated our healthcare workers quite thoroughly on how to use PPE or personal protective equipment. And that's, for example, a gown, gloves, face mask, eye protection, all the things that healthcare workers use when they're seeing somebody who does have this virus. And so we've done a lot of simulations, trainings, emails, email blasts, videos, et cetera, to teach people how to do this. We're always available for questions. Infection prevention is headed up by a professional. It has staff, including a physician, who also are educating our employees as to how best to protect themselves.
Speaking of masks, are N95 masks worth it? And should I get one?
So don't go looking for and hoarding masks, okay? They're a double-edged sword. An N95 mask is a great thing for a healthcare worker to have in the hospital if they're seeing a suspected case or a proven case, because it probably does provide the best protection to the healthcare worker. For people out in the community, we're not recommending that they wear masks unless the public health authorities or the hospital has told them to wear the mask because they were discharged from the hospital with the infection. And the reason, there's several reasons. Number one is that the regular surgical masks are no longer available. They've been taken off the store shelves. They may or may not work as well as N95s. And the other problem with a surgical mask is if you wear it, do you really know how to take it off in a safe manner without infecting yourself? And our fear is that people will put these on, they'll touch them, the virus will get on the outside, perhaps from somebody coughing near them, and then when they take the mask off, they're going to contaminate their hands, and then they're going to touch their eyes, nose, and mouth and get infected. So it's kind of a double-edged sword. Bottom line is the more important thing is the social distancing. Stay home if you're sick, but don't go out and buy up all these masks. And honestly, you won't be able to find them because they're in very short supply.
Who should be tested, and how do we get tested?
Great question, and that's a very fluid situation. We are looking at more options in the coming weeks. Bottom line is, if you are sick, i.e. you have fever and or cough and or shortness of breath, and you live in a place where COVID-19 has already been reported, which is many places around the United States, including New Orleans, then you need to contact your healthcare provider. The first thing I would say is take a deep breath and don't panic, okay? If you have symptoms, it's just as likely that you have the flu or the common cold or something else. But we do need to have a lower threshold for considering testing. So you call your provider, and your provider, whether it's your nurse practitioner, your nurse, your doctor, whoever, is going to give you instructions. Getting testing right now for the general public is not easy, but it is becoming increasingly available. It will be available very shortly through the federal joint venture with, it's a public-private venture where people will be able to do drive-up testing in the parking lots of places like Walmart. This is being staffed by public health officials and others, and this will allow more testing. Here at Tulane, we are working on some testing for our people that would allow people to drive up. And there are other sites around the city that are beginning to ramp this up. The bottleneck right now is that there are not enough of the tests and the kits that include a swab and a little test tube with liquid medium in it to actually perform as many tests as we would like. So we're waiting for the supply chain in the United States to produce and deliver more of these kits. And at the same time, the testing companies such as LabCorp, Quest, Tulane's hospital, all the different hospitals and other labs are also working on ramping up testing. The good news is that one of the big companies, Roche, has gotten FDA approval to send out their test that allows hospitals to do hundreds of tests daily.
How long is it from exposure to feeling sick?
So it's somewhere in the vicinity of 2 to 14 days. That's what we call the incubation period. That means the time from when you get exposed to the virus until the time that you know you're sick, okay, whether it's the fever or cough or what have you. On average, it's about 5 to 7 days, if that gives people a little better idea. So you can kind of think about almost a week that it takes. There's always going to be some outliers. Everything in medicine and biology, for the most part, is a bell-shaped curve. What that means is that 95% of people behave in a typical way, and 5 or 10% of people don't behave and are a little bit unusual. So 2 to 14 days is a good rule of thumb.
How long are people contagious? How long before people start to feel sick? And how long before they start to feel better?
Well, those are tough questions to answer, and these are parameters that scientists and doctors are looking at and will have more information about in the coming months. In general, if you get sick, you're probably looking at recovery time of 1 to 2 weeks, but it can vary. There's some people that get better in 5 days and some people who take 3 or 4 weeks to get better. It probably depends on how sick you are. If you're not as sick and you never get really sick, it's quite likely that you will get better. We don't know for sure how long people are contagious for. It's probably, again, the same concept. If you're super sick, you probably have more virus that you can transmit, so you're more contagious. Therefore, you may be contagious longer. If you're not as sick, perhaps not as long. We don't know exactly. But to give you some sense of the timelines here, if somebody gets sick and they have a positive test, the public health officials ask that we test them in 7 days. And if they're negative in 7 days, then we get one more test at least 24 hours later. And if that's negative, then we can say that they've cleared the infection and they're probably not very contagious.
So you're actually treating many of the local patients. Are any of them getting better?
Yes, a lot of them Probably most of them are getting better. A few are still critically ill. But I'm seeing, in general, people are stable, getting better. Remember, the vast majority of people, at least 80 to 85% of people who are diagnosed with this infection either have no symptoms, very, very mild, or just mild symptoms and do very well. But it's that 10 or 15% of people, perhaps up to 20%, who are sicker, who require hospital admission. And then not all of those people have to go to the intensive care unit. Just a fraction of those people get super sick, requiring ICU care. We'll learn more about this in the coming months. And one of the things to remember is that just because the disease behaved a certain way in China doesn't mean it's going to behave exactly the same way in other places. And we are seeing some differences. And those are things that, thankfully, due to the ready access to data, to the internet, it's much easier to compile this data than ever in the history of medicine and science. I'm flabbergasted at how quickly the Chinese and other groups that have seen the virus earlier than us are getting their data out and getting it published. This is absolutely unheralded in our history to see data coming out in just a few weeks.
Why are younger people not getting as sick as the older patients?
That's a great question, Sharon, because of course we're all hearing that young people and children don't seem to either get the virus, or if they get it, they don't seem to be very sick. The problem is that there's some evidence that they might be carriers or spreaders. So they may be able to handle the infection better and not get sick, but they could potentially be contagious. And because young people like to get out and hang out with each other and are very mobile and often feel invincible, they may be more prone to taking chances and potentially spreading the virus. So I think that is part of the reason why we're closing schools, encouraging young people not to congregate at, hanging out at bars and going to parades and things like that. But at least the silver lining here is that at least it seems as though young people, and children in particular, do really well, which is rather different from other viruses such as the influenza virus. So maybe a small silver lining there.
Should we be out of our homes unless it's absolutely necessary? For example, is it a good idea to go for a walk in the park or in the neighborhood?
Yeah, sure. So I would say that we should all lie low, hunker down, camp out at home. I would not go to restaurants, movie theaters, bowling alleys, groups of people. What I would say is stay at home. Yes, definitely go outside. Fresh air is probably a good thing. It has a very natural ability to disperse viruses and toxins and things like that. So absolutely go for a walk. But at the same time, don't walk up to somebody and start chatting with them. Keep at least 6 feet apart. Keep your dogs away from other people, because it's possible that pets might become infected and could eventually spread the virus. That's not absolutely known right now. But bottom line is, yeah, go outside if you want to go outside and exercise, or walk in your yard, out in front. Just don't congregate in these locations. But definitely, I'm a strong believer that being outdoors is good for our health. There's actually scientific evidence that being around greenery and trees makes us feel better and actually improves our health.
How about the gym? Is it safe to go there?
Probably not a good idea. Granted, some people claim that, well, if I wipe down the equipment and I'm spaced at least 6 feet away from the next person, I don't think this is the time to be going to gyms and congregate settings. It's just not worth the risk. A little bit of pain now and a lot of gain down the road. And as the Surgeon General impressed on us last week when he came here to Tulane, he impressed on us, this is the time to lean in, the time to make sacrifice, be inconvenienced, do the hard things that are hard to do, but that will pay off in 2 to 4 weeks, because that will help to mitigate the severity of this epidemic.
One of the things we've heard is that COVID-19 can permanently decrease our lung capacity. Is that true? And if so, is it permanent?
Yeah, so there have been reports of that, and that doesn't really come as any surprise, because if you're one of those few people, the minority who gets really sick and say has to go onto a ventilator machine, and you say you develop adult respiratory distress syndrome, or ARDS, we've known for a long time that those people, when they recover, still have breathing issues, maybe not necessarily permanent damage, but long-term side effects. And so I think what's going to happen is in the next couple of months, we're going to learn more about that as we start to follow those people over a period of months. I'm a big believer, though, in the power of rehab, physical therapy, taking care of oneself, and tincture of time. Some things that are reported to occur a few weeks after an illness get better. In fact, most things get better with time, and so I think there's still a lot of hope. But yes, there could be some permanent damage.
Does COVID-19 cause any other sustained damage?
Not that I'm aware of. I mean, there may be some isolated reports of some other unusual complications. I mean, the good news so far is that we haven't seen damage to, say, the fetus in pregnant women, although it's still possible that that could occur as larger numbers of pregnant women become infected. There are always going to be a few outliers. There's going to be people that get meningitis or encephalitis, and people that are going to get other complications. But at this point, they appear to be in the minority. Again, in the coming months, we'll have much better evidence or data to look at to tease out from thousands of patients what the clinical spectrum of this new disease is.
Do we know how many people are able to carry the disease but not show symptoms?
No. And initially, it was thought and certainly hoped that almost nobody without symptoms would be able to transmit, i.e. asymptomatic persons. There is a little bit of data now out there from around the world that it's probably possible for some people who haven't yet developed the cough or the fever, i.e. who still don't have symptoms, to transmit the virus. There are some examples of some outbreaks in certain parts of the country where they think this may be the case. And so, again, like every disease, nothing's 100%, nothing's 0%. Most things are shades of gray, and therefore there probably will be some exceptions to the rule, and there will be some people who don't have symptoms. Sometimes people have symptoms and they don't talk about it. They don't say, yeah, I have a cough, I have a low-grade fever. People tend to downplay things, so sometimes when you go back, you find out that in fact they did have symptoms. Either way, yes, I'm sure there are going to be some people that will spread it, but we're hoping and we think that at this point, it's really the people that are sick, and particularly the sicker patients, who are the probably most capable of spreading the virus.
This isn't the last time you'll hear from us, and we want to know what questions you have. So please email us at medquestions@tulane.edu.